How do you know if you're getting enough return on investment from your dental marketing? Now, the answer is to measure it, and not with some soft and fluffy metric, but with hard data. You can and should use measurement approach with social media as well as concrete things like calls to your office. I'll be back with a 5-step process to do just that after the break. Welcome to the Patient Attraction Podcast. I'm Colin, Receiver, founder and CEO of SmartBox Web Marketing. Now, if you're working with a dental marketing company, you deserve to know exactly how your marketing is performing. The way that we measure return on investment has changed a little bit over the years. For instance, impressions used to be one of the soft, fluffy measurements that was used to sell advertising. But with more and more marketing being done, not only online, but with more direct response feedback, measurement is both easier and more accomplishable and a lot more precise. Here are 5 steps to getting hard data on how your marketing is working for you. Step 1, you have to determine what your objectives really are. Obviously, the end goal for dental marketing is to put butts in the chairs, and that's the metric that really counts, but there are others. Step 2 is to establish the leads that lead to your end goal and how to track them. Now, these steps are going to include a patient calling the office. How many of those calls result in appointing patients? And how many of the people that schedule those appointments actually show up? The third step, how you might want to track, is also how many people are responding to your marketing emails. This step especially applies if you're using an outside marketing team. You'll need to enlist them at the start to handle the data collection, or at least to advise you on the best ways to proceed. And once you know what you want to track and how, it's budget time. That's step 4. During a period of time, take 3 or 6 months or even longer, follow your marketing plan and then gather your data and determine your ROI. That becomes your baseline for measuring the effectiveness of your marketing. It also serves as a guide for investing in the future. Number 5 is to monitor, analyze, and correct. Figure out what parts of your marketing program are working well and which need to be changed. Don't get bogged down in over-analyzing things. It should be clear what's working and what's not. What shouldn't happen is that you need to change how you collect data. But if it does, absolutely take the steps to make sure you're getting the right kind of data that you need. Adjust your plan, determine your investment, continue to monitor, rinse, wash, and repeat. Now, remember, all of this is for one singular purpose: to attract more and better patients, and also to keep the ones that you already have. Tomorrow's podcast, I want to cover marketing to potential patients with severe, deep disability dental needs that require extensive work. Until then, keep moving forward.